National Education, Health and Allied Workers Union has hailed the vaccine rollout, calling upon government to acquire more COVID-19 vaccine doses. The union is encouraging health workers to register online to be vaccinated. For more on this, I'm joined now by NEHAWU General Secretary Zola Sapeta. Zola, good evening and thank you very much for joining us tonight on the Newsfeed Late Night. Why was it important that you volunteer yourself to be amongst those who actually take the jab publicly?
Good evening to you and the viewers. We, after analyzing the impact of the distortion about the vaccine, we have felt that because we have studied the results of the trial conducted in 4 continents, including South Africa, and we have seen the results, we felt that we must encourage our members to be vaccinated because there's no other option or any other solution other than the vaccine. And we felt that we must join the line so that we give confidence and inspire members to follow the whole process of vaccine because it's important for them to do so.
Yeah. A large number of those that I have spoken to and nurses unions and so on and so forth, these are healthcare workers who, for some reason, don't seem to have buy-in into this whole vaccination process. Where do you think we are missing the mark here?
The reality of the matter is that health experts themselves have created this confusion, but also, as you know, that the healthcare workers have been traumatized and feeling the anxiety since the 5th March 2020 with no protection in the form of PPEs and also in the form of health committees, health and safety committees. As a result, they've been contracting this disease. Others, they've been hospitalized, and also we've lost about 663 healthcare workers in relation to this. And therefore, boom, the surprise on the AstraZeneca, and also that made the workers, healthcare workers, to lose hope completely. So now we are really boosting and also mobilizing for them to be recipients of this vaccine because this vaccine is going to help them. Yeah. So also one of the big problems in South Africa is an extent to which we empower the population with an information. So we have been weak in terms of the educational awareness program to educate our people to appreciate different diseases and also form of viruses and the extent to which these things can be overcome.
What is your view on the Johnson & Johnson vaccine itself? I mean, it is a one-jab vaccine. It is one that I believe can be stored in normal refrigeration. So it's one that is not necessarily going to be cumbersome as far as our infrastructure and our capacity is concerned.
Yes, but it's the one that has been offered to us now after the AstraZeneca, and it has been proven to be working because it can save 100% the COVID from death. It can also give efficiency, 85% protection on the severe COVID, and also moderate to severe, it can be 57% protection. Therefore, it's what is working for our new variant, and we must take it because we are aware that the government has been busy, hard at work in terms of engaging other manufacturers and countries for other forms of the vaccines, you know. So currently, this is what we have. We must use it with a hope that we'll get more, that will not necessarily be more complicated, that will suit all the infrastructure we have here in South Africa.
Yeah. There is, of course, the other question also of the president addressing it today in his response to the SONA debate, saying, well, he's tasking the higher education department to come up with research and solutions and ways to see if South Africa cannot come up with its own vaccine. How do you view that, and what is your analysis of that situation?
But we think that that is too late. Institutions of higher learning are centers of knowledge production. They should have been busy, preoccupied by the solution, particularly when you have also healthcare science in this institution. So there have to be institutions that are helping nations to overcome all challenges, particularly as it relates to the health of citizens. We are welcome the challenge put by the president, but we do think that it took long because we have been also hearing the minister saying that there's a research conducted and so forth, but it should have been led by universities by virtue of being centers of knowledge production.
Now, these are 80,000 or so vaccines that we have received. I believe in the next week or two, we'll be receiving another 1 million or 2. I mean, is the procurement process aggressive enough as far as meeting the targets of 40 million people vaccinated, at least by the end of the year?
On Johnson & Johnson, we have been offered 300,000 doses, which will not even respond to the capacity of healthcare workers in the country. As you will know, that the projection has been 1.2. So the 30,000 is very minimal. But in the absence of anything, you take the little that can be offered, with the understanding that government is trying its best to secure more. And given the fact that there has been announcements in terms of the vaccine that has been secured, but they will come so late. Others, they will come end March, others May, June, July. And this one, Johnson & Johnson, we had received a day before yesterday, 80,000, which would get another 80,000 2 weeks later, and another 80,000 2 weeks because they come in the form of 2 weeks tranches until the 61, which will make it up to 300,000.
Now, there are concerns around the transparency which surrounds this procurement, and generally you know what it's about. That is the fear of possible corruption actually creeping into the procurement of these vaccines. Is NEHAWU concerned at all?
Certainly. We are an organization that encourages transparency. And you'll remember that the government from the onset, they've promised the South Africans that they will be transparent. They will take South Africans step by step, and the government had committed to centralize even the issues of tendering, which will be handled by the National Department, and we are hopeful that the department will live to their expectation. But any sign or a signal that seeks to suggest any form of a corruption will be met with us hard. We will not allow it, and we'll fight throughout because we are against corruption.
Zola Sapeta, appreciate your time and thank you for joining us tonight. That's the General Secretary of NEHAWU, Zola Sapeta, among those who received the jab of the Johnson & Johnson vaccine.